Good morning, A people. First of all, thank you so much for making time for today's hashtag Protected Together info session. My name is JC Anad and I am from the corporate HR team of AEB. And it's nice to see all of you again. We have done several info sessions that started at the early part of the year when we were still familiarizing ourselves to how the vaccines work. And then we had pre and post vaccination. And just recently, we did a session on Delta and the other variants of COVID-19. And in today's session, our speaker will be explaining the effectiveness of the different types of COVID-19 vaccines after getting the actual shot and the new infections arising. We have allocated more time for question and answer. So if you have questions during the presentation, you already know the drill, send them in via the Slido link provided in the caption. So allow me to introduce our speaker for today. He is currently the head of the Adult Infectious Diseases and Tropical Medicine Department of the San Lazaro Hospital and a member of the DOST's Vaccine Expert Panel that evaluates, selects, and that the government could purchase. Everybody, let us all welcome Dr. Ron Jean Solante.
Hi, good morning.
Good morning, Dr. Jean.
Thank you, JC. I'll share my screen for a while.
Po.
Okay. Kita niyo na?
Yes, Doc, we can see it.
Okay. So first of all, thank you for this invitation. And it's really, on my part, it's also part of our role here as an ID expert to give correct information on vaccination. And especially now that we're almost on the 6th month after our vaccine that we received like March, no? So most of us healthcare workers received the primary vaccine last March. And there are already talks of a possible booster or waning immunity. So let's take a look at the data on that now. So I'll start first with the variant of concern because I think this is the main reason, one of the important reasons. Initially, we thought that this will be the game changer in which we're giving vaccines to everyone because the fact that this will have an impact on how vaccines will work against these variants of concern. Talagang inaasahan din natin na bababa ang mga bisa ng mga bakuna. And you know that the Philippines, the most dominant variant of concern now is the Delta variant. Okay, and in this table, ipakita ko lang sa inyo that when you look at this table, these are the potential consequences when we have these variants of concern. So as I've said, all of these variants are highly related with highly transmissible virus. Okay, so if you have a Delta variant, you can infect 5 to 8 people. No, if you have the Alpha variant, you can infect like 4 or 5. So you have highly transmissible. But the other part here is that it can also, or these variants of concern, can also decrease the ability of our antibody that we produce from a vaccine, also decrease its ability to neutralize the virus. No, so hihina siya ang the way it will eradicate the virus. And let's see the data. No, so how effective vaccines now? Now let's take first that the first data that we had when these vaccines were approved for EUA in the Philippines. So I only included here all the vaccines that we have now here in the Philippines. Of course, you have Pfizer. Nakita naman natin as very high efficacy, 95%. AstraZeneca, 70%. Then you have Sinovac, no? Maski ang efficacy nito mababa, 50%, 60%, pero kinuha pa rin natin. We still have to get this because during that time, we don't have any vaccines to give to the healthcare workers. Then you have Sputnik at 91%, then Moderna, 94%. Janssen, you have as high as 70%, then Covaxin, and then you have Sinopharm. No? Now, at the other spectrum of the vaccines, no, we said that, yes, it can protect us against getting the infection. But the more realistic benefit here is also protecting us against severe COVID. And majority of these vaccines is very good against protecting us against severe COVID, almost reach 100% in the clinical trial data. Now, what is after the variants? Okay, so this is a publication from the WHO as of September 2021. And here we can see all of the 8 vaccines that are included in the study against Alpha variant. Okay, so just to walk you through some of these icons here, you have both arrows sideways, then meaning there is reduction, less than 10% reduction. Okay, so that means the vaccine efficacy is still at least 90%, no? But if you have an arrow down, then you have 10 to 20% reduction in vaccine efficacy. So in terms of the efficacy, severe disease, symptomatic disease, and infection, it seems that with the Alpha variant, most of these vaccines, like the Pfizer, the Moderna, then you have the Astra, okay, the efficacy has really been affected, no? But not much. Okay? And even in the neutralization of the antibody of these vaccines, neutralizing the Alpha variant is also affected. So the WHO said, still, if you are using this for COVID, protection is still retained, no, against all outcomes. So that's enough to significantly affect the performance of this vaccine. Now, what about the Delta variant? Okay, so this is the Delta variant. And you'll notice that majority here, nagdadalawang arrow yan, no? So meaning there is 20 to 30% reduction in the vaccine efficacy. And obviously, even with Astra, Sinovac, and then you have the Covaxin, Pfizer, Moderna, all of these really are affected by the Delta variant. So what's the implication here? There is a possible reduction in the protection against symptomatic disease. So meaning you can still get the infection. And despite being vaccinated, there's a possibility you will still be getting the infection. But here, the other advantage is that against severe disease, medyo na-retain, no? Na-retain, okay? So, ibig sabihin, protected ka against the severe disease, and then, but against getting the infection, you are not protected. So, there's the decrease in the protection. So, that's the effect of the Delta variant. And likewise, we have noticed that the first of those report in the United States that among those vaccinated, fully vaccinated, compared to non-vaccinated, the virus, no, the amount of virus were measured here. So there are less of the virus in those vaccinated. So mababa. So, and at the same time, duration of the detection is less. So less number of days when you are vaccinated compared to an unvaccinated. So the message here is that even if you are vaccinated, it doesn't mean you will not get the infection. And this is what we've been saying. No? There's still a possibility that you still get the infection. But the advantage of being vaccinated is you only have lower virus in your body. It resolves faster. So meaning the viral load will lower down faster. And that's why you have a shorter duration of illness and you have less of the symptoms. So overall, you'll have fewer sick days compared to an unvaccinated. So that's still important, no? Because even if you are vaccinated, your risk of getting the more severe form is more important now than any other parameters, no? Okay, so it's more of like a life and death. You don't have the vaccine, higher chance of dying. You have the vaccine, lesser chance of dying. Now, breakthrough infection. This is what we call breakthrough infection, meaning after getting the vaccination, fully vaccinated, you still get the infection. There are several factors to consider here. Number one, time from vaccination. Studies have shown that the neutralizing antibodies of most vaccines wane 6 months post-vaccination. So ibig sabihin, bumababa, no? 6 months after. Pero the argument here is that neutralizing antibody is not the only protection that we have when we are getting the vaccine. No? We also have the cell mediated protection, which is your B and T cell memory. So they said even if your neutralizing antibodies wane after 6 months, but there's still some protection, and that's the reason why the risk of severe infection is still being preserved even if you get the infection. Number two, vaccine type. No, there are vaccine types that easily wane compared to another vaccine type. So, like for example, no, when you look at data with the Chinese vaccine, Sinovac, or even Sinopharm, compared to a Pfizer or a Moderna, obviously the waning immunity with Sinovac and Sinopharm is a bit earlier compared to your Pfizer and Moderna. Okay, but even with Pfizer and Moderna, if you look at, I will present later data from other countries. After 6 months, they also tend to wane in terms of protection. I have mentioned this one, variants of concern also neutralize and affect our vaccine. And of course, the most important population, those who are immunocompromised. Even with vaccination, 2 doses, I think there are data already that you need 3 doses for immunocompromised, those with cancer, those with post-transplant individual. The 2 dose vaccination may not be enough, and you need another dose to maintain a higher protection. So this was one of the first data reported last August through the MMR US CDC. And they were getting infection starting from May 3 to July for their vaccinated individuals. And when they look at the estimated vaccine effectiveness from 91.7%, okay, this is using the Pfizer and Moderna vaccines in the US. It dropped to like 79.8%. So it's just a matter of from May, June, July, matter of 3 months, no? So more or less 80%, no? But that's still a very, very good vaccine effectiveness. No? The problem here is that even if you're fully vaccinated, compared to an unvaccinated, fully vaccinated infection is 9,675 plus. For unvaccinated, it's 38,000. So that's a very big difference because you only have 1.31 compared to 10.69. And when they compare it among those hospitalized, there are still those, the unvaccinated occupies the more beds in the hospitals compared to those who are fully vaccinated. Okay, so the advantage here is still with the vaccine, but it's a proof that there are already breakthrough infections. Data coming from Europe and Canada and Israel with Pfizer vaccine and against Alpha and Delta, you'll notice that all of these countries still experience a very good protection against hospitalization with your Pfizer vaccine, even with the Alpha and the Delta. But if you look at the data on the protection against getting the infection, there's really a reduction, like 79% in England and Scotland, 87% in Canada, and I think Israel experienced a very low efficacy at 64%. So meaning you can get the infection even if you're vaccinated, but you are still protected against hospitalization. Same as that with AstraZeneca, because of the Alpha and the Delta variant, you still get infected. There's still infection noted among those vaccinated, and efficacy with Astra, especially for the Delta variant, was like 60%, but with hospitalization, it's maintained at 90%. Okay, so meaning these are data that we're really seeing now that as months has passed from that time that you were vaccinated, there's really a waning protection. Okay, another data coming from the UK with Pfizer vaccine, effectiveness dropped to 90% after 30 days, 85% after 60 days, and 78% after 90 days. Same as that with AstraZeneca, especially for high load infection, dropped to 90 days. Okay, a study done in Israel, wherein they look at the population that were given the vaccines and monitor their antibody level, and you'll notice that those who are 60 years old and above are really those that has lower antibody level after 6 months. Okay, so they had their vaccination in January, monitored them up to June. So you'll notice that the 60 years old and above has the highest decrease in the antibody. Okay, so waning protection 6 months after. And in fact, there was a direct correlation here that for those whose antibody decreased, no, they were also the persons that developed the infection. Okay, so there is a good correlation of those that even if you're vaccinated 6 months after, you have decrease in the protection. And these are the factors, no? Factors associated with COVID-19 infection, despite giving the vaccine. So for those vaccinated in the January to February, were higher risk of getting the infection after May. Okay, while for those who were vaccinated in May, did not get the infection because there's still protection. Age group, 60 to 75 years old, but here in their data, even 18 to 44 years old or 45 to 59 years old still developed the infection despite being vaccinated, and younger population because of that waning immunity. And then, of course, you will notice that among those with heart disease, diabetes, again, related with more breakthrough infections. For Sinovac, I think the Chile data tells us everything about how good Sinovac is, and in terms of the number of persons that were given the vaccines then, no? In February to May, 10.2 million persons received Sinovac. And look at the overall vaccine effectiveness. For more than 18 years old, against symptomatic COVID is 65%. Against hospitalization, it's 87%. IC is 90%, and death is 86.3. So that's really a very good vaccine. Okay, and for the 60 years old, because they have the most number of 60 years old given this vaccine, although protection against symptomatic COVID is 66.6%, but prevention of hospitalization is 85, 89, and 86. No, but on July of 2021, when the symptomatic COVID protection drops from 65.9 to 58.5%, that's where the government decided to give third dose regimen of Sinovac in that country. This is another data from China. This is a preprint wherein they look at immunogenicity and safety of a third dose. They were able to enroll 500 adults ranging from 18 to 59 years old. Okay, so this is the antibody level, no, after 2 doses. So you notice that schedule 1, 22, 25, and then 39.6 and 49.1. But when they give the third dose of the Sinovac vaccine after 6 months, okay, it seemed that for those who were given the vaccine 6 months after, compared to a booster dose before 6 months, the red one here are given 6 months, third dose 6 months after giving the full 2 dose. You have a very high antibody production. Okay, from 25 it went up to 137. From 49 it went up to 143. And for those who were given a booster less than 6 months, it seemed that the booster did not help much. No, so I think the rationale here is that you have to give the booster. It should be 6 months after. Okay, so post dose 6 months after is 3-fold higher, okay, than the 2 dose schedule. Okay, so there was a very high seroconversion rate, meaning produced more antibodies. Okay, So that's something that we really want our vaccine, no? Give us protection through this neutralizing antibody. Okay, another study here, they also tested Sinovac with the different variants of concern. It seemed that the variant that affected Sinovac is the Delta variant. Okay, so meaning it has the lowest number of, it's got the lowest level of neutralizing antibody if you deal with the Delta variant. And this has affected the decision of some ASEAN countries like Indonesia, Malaysia, and Thailand, that they are now giving a third dose among their healthcare workers with either an mRNA vaccine or an AstraZeneca vaccine, just to maintain their protection against the infection for the healthcare workers. Okay. So here you can see that only 48.3% developed neutralizing antibody as more than 20 compared to a natural infection. So meaning mas mataas pa ang protection kung meron kang, if you have recovered from COVID compared to the one that if you don't have COVID and you're given Sinovac and you're infected with the Delta. So that's how they look at this. Okay, but for the Alpha and the Beta data, really good protection with the Sinovac. Okay, mRNA vaccines like Pfizer and Moderna is not an exemption, even if they have a very high efficacy during the first 2-3 months. But after 6 months, this is the data from Qatar, when the Delta variant was dominating in that particular country. Look at the Pfizer efficacy vaccine. It's only 53.5%. No? Moderna is 84.8%. And again, the vaccine still protect them against severe critical, but more people are getting the infection, but less are still going to the hospital. Data from the US with Pfizer and Moderna post the Delta. So look at the efficacy. It's really low. It affected the efficacy of most of this vaccine. And this is also from the Israel trial, wherein the protection against the COVID virus after getting the third dose or before the third dose was given, very high breakthrough infection. And that's why, especially for the 60 years old and above, they prioritize the 60 years old and above to be given the third dose, because of most of these 60 years old develop severe disease, even if they were vaccinated. Okay, so here you'll notice that protection of Pfizer vaccine booster against COVID-19 in Israel after getting the third dose from July to August. Okay, that is at least 12 days after the booster dose. The rate of confirmed infection was lower in the booster group, okay, by a factor of 11.3. And the rate of severe illness was lower by a factor of 19.5. So in short, the ability of this vaccine to have a better protection when you give a third dose only elucidate that with the 2 dose, it may not be enough, and there's a waning protection after 6 months. Okay, so this is the data from Israel. So if you look at their data here, the number of cases, older population who received a third dose, leading to a substantial decrease in confirmed infections among those 60 years old and above. Okay, so when they give the booster here, look at the trend here, above 60 years old, bumagsak ang kaso nila sa elderly population. And ito yung pinakamagandang data na nakikita natin na when they also give the booster dose among this population, severe cases sharply decrease. Okay, so this is the 2 plus the third dose, more than 80% of adults. Look at the new severe cases drastically decrease. So in essence, no, the Israel experience was also the basis for some of these countries where they are now giving booster doses for those 60 years old and above, for those who are immunocompromised, and for those who are higher risk of mortality. Okay, so another data here from the US, wherein when they look at the fully vaccinated and after 5 months, there really was a drop in the efficacy, 47%. No? So this is the Pfizer vaccine, and its efficacy was also affected by the Delta variant. But again, when you look at hospitalization, it seemed that the hospitalization was admission was still lower for those who were given the vaccine. So the study suggests that reduction in the Pfizer vaccine effectiveness over time are likely to be primarily due to waning vaccine effectiveness, okay, rather than the effect of a Delta variant escaping vaccine protection. So on that note, we now have an idea that most of these vaccines protection will really wane over time. Okay, and just to elucidate to you again, no, among those population is really the elderly population that will really be affected after 6 months because of a waning immunity, and chances are they will still be higher risk for hospitalization. But again, with development of severe COVID, at least the protection is still there. Okay, and then this is the data coming from Brazil for Sinovac. Okay, and this is just to give us an indication here that the effectiveness of this vaccine still good, but it's really lower, especially among the population that are of higher age. Okay, so here the protection is against hospital admission was 61.2%, but vaccine effectiveness was highest for the youngest age group. Okay, compared to the elderly. Okay, so if you're looking at like 59% against symptomatic disease, feels good. That's still a good protection. 77% against hospital admission, and 83.9% against death. No, okay. So there is a higher chance that if you are 60 years old and above, and you have received Sinovac, then your protection will always be lower because of the ability of your immune response being in elderly population, lower ability to produce the antibody. Now, I would like to share my data here in San Lazaro Hospital when we have the cases from August to September, okay, among those who developed severe, critical, and non-severe. So I separated those who were vaccinated and those that were not vaccinated. Okay, so like for example, in severe, 59% of the severe are unvaccinated, while 41% of those who develop severe are vaccinated. So you will ask me, why is it that even if you're vaccinated, you still develop severe? So probably, again, because of the waning protection. And more or less, when we look at those who are vaccinated and still develop severe, 57% of those receive Sinovac, okay? And then 19% receive AstraZeneca, 12% receive J&J, Moderna, 3%, and then 9% Pfizer. Now let's take a look at those who develop critical COVID. So again, more or less 70% are unvaccinated and 30% are vaccinated. And again, the same question, if you are vaccinated, why did you develop critical infection? Mainly because the waning immunity protection. And again, this has been attributed to those who receive Sinovac. 60% of those who who are vaccinated and develop critical infection are given Sinovac, and then you have AstraZeneca, 8%, J&J, 16%, Moderna, 13%, and then Pfizer, 2%. So in a way, you have this idea now that even if you're vaccinated, there's a possibility that with waning protection, then higher risk that you can develop severe infection. So if you look at all of these vaccines from Astra, Pfizer, Moderna, Sinovac, and Janssen, there are already data of booster studies. Okay, like let's say, for example, the AstraZeneca, after 6 months, they did they did give third dose in their data, and they found out that there was 6-fold increase in the antibody and maintained the T cell response. So meaning you have a very good immune response when you were given a third dose. With Pfizer, antibody response against SARS-CoV-2 increased 3-fold after the second dose. Okay, and then with Moderna, their data was on immunocompromised transplant recipients whose third dose was able to substantially enhance immunogenicity compared to those who were not given a third dose. And then I've shown you again the data a while ago in China, where they did give third dose after 6 months, and it resulted to a remarkable increase in the antibody level. And there's this new data now with Janssen that the second dose generates a rapid and robust rise in the antibody, 9 times higher than the single dose vaccination. So probably again, all of this vaccine, no exemption, all of this in individuals who are immunocompromised, 60 years old and above, and probably I will also include the healthcare workers, are vaccines that protection has waned after 6 months, and a booster dose should now be in the conversation. Okay, now this is not to undermine our program of the government, that our focus is still vaccinating everyone. Okay, so this is in the context that since we want everybody to be getting the vaccine, regardless of this waning immunity, we will be recommending this booster. Then we'll only recommend this to a very few number of population, not for all. Okay, prioritize those that are higher risk of mortality, like the 60 years old and above, or those who are immunocompromised. But for the general public, it can wait until such time everybody will be getting the vaccine, or more people will be getting the vaccine, because for me, it's really unfair getting the booster and kasamahan ninyo wala pang bakuna, then those unvaccinated are still the one that's vulnerable and can transmit the infection. So just to give you another data here, why in the United States and in some other countries now, they're giving a third dose of the Pfizer, because it mattered a lot when they give the third dose among 18 to 55 years of age and 65 to 85 years of age. There's really a higher protection because of that waning protection 6 months after. Okay, and even with the Delta variant, was able to maintain its efficacy with the third dose. And I think this is the data that can also say that we don't need a variant-specific vaccine, because even with this population, protection against Delta variant has been very high. Okay, so what is the current situation now? We know that waning protection is a reality. Anyone can get the infection after 6 months. It's just a matter of how you look at this in terms of the perspective of a limited supply of vaccine, meaning we need to protect ourselves even if we're vaccinated. Obey the health protocol, wear the face mask, the face shield when we are in a high risk area, so that we continue to be protected, especially against this breakthrough infection. Yes, booster can be a possible option, particularly for those who are immunocompromised, those at higher risk of developing severe infection. And there is also now a possibility that we can also consider what we call heterologous dosing. Okay, so meaning mixing two different platforms wherein you have higher protection compared to a homologous vaccine. Okay, so the question then is, will booster doses be required for COVID-19 vaccines? Then we need to balance this, as I've mentioned, regarding the achieving a herd immunity, and at the same time, the ability of this vaccine, even if the neutralizing antibody is decreasing, ability to be protected against hospitalization. Okay, so I think this is my last slide, and I'm ready to answer questions or if you have inquiries. Thank you very much for your kind attention.
Thank you so much, Doc. There. Okay, thank you so much, Doc, for that presentation. I've learned a lot, especially on boosters. Boosters are important, but now, well, ethically speaking, it is more important for us to vaccinate more people. Well, in our nation, no, in the Philippines. Let me go to the questions. We have a few in Slido already. So for the first question, Doc, is it necessary?
Hi, JC. Can you repeat the question? Can you repeat?
Sorry. Yeah. Is it necessary to get booster shots, and should it be the same brand as my vaccine?
Okay. I think I have reiterated that now that at this point in time, even if we want to give the booster shot, but because of limited supply, probably once the government will recommend a booster, it will not be for everyone. It will be only for the selected high-risk population.
Okay, Doc. So high risk meaning 60 plus and immunocompromised.
Yes,
Okay.
correct.
Will booster shots now become an annual requirement moving forward? Will this be more like, okay, will this be more accessible in the future, like flu shots? Where do you see this going, Doc?
Yeah, I think so, no? Because if you look at the data, there is really waning protection, and the third dose was able to increase the protection. The most important question then is, if you're given a third dose, how long will be the protection? Will that be for 1 year,
Yeah.
or will that be for 2 years? No, we don't know. We still will need to observe and gather more data. So with that particular question, my answer is there is a possibility that we can be getting a yearly vaccine for this COVID-19, and in order for us to be protected always, how long? We don't know. 4 years, 5 years.
Okay. I am immunocompromised. I am diabetic and cancer survivor. Who will give the authority for a subsequent booster shot?
Of
I'm
course,
guessing
you
this
are.
will be the government. Sorry.
Yes, yes. You're qualified. No, you're qualified to get the vaccine, and I hope you have already taken the primary vaccination. Okay. The only question then is when will be the booster shot? So that's the question. So if government allows booster shot for next year, and then you'll be the priority.
Do you have any? Okay, so are you saying, Doc, that this could happen next year, the booster shots?
I'm not closing the possibility that it will be given this year. Again, JC, it will really depend on the limited or the supply of vaccine, because here in the VEP, we already made our recommendations on which population and what population to prioritize and what vaccines to give. So it's just a matter of really looking at what is the priority. Will we be giving booster to everyone or to the specific population, and at the same time, more vaccines for those that has not been vaccinated yet? So it's really something like that. No?
Let me make a follow-up on that, Doc. On scheduling and on booster versus the vaccinating those the minor population, Doc, the 12 to 17. Do we have any update on that?
I think we are now starting the 12 to 15 for Pfizer, 12 to 17 for Moderna. No, I think there are already hospitals identified to start inoculating this population. Okay? And balancing vaccinating everyone and giving booster, it's really a tough task now, because my answer to that is, number one, yes, we should be giving the vaccine to those who are not vaccinated yet. But again, we should not forget also that there are population whose immunity has already waned after 6 months and can be another risk of transmitting the infection because of that waning protection.
Got it. Next question, why do these COVID vaccines protection wane over time, unlike other usual vaccines that we only take 1 or 2 shots in our lifetime?
I think the important answer there is that compared to other viruses, no, this virus has a higher threshold of protection. So meaning you have a higher level of you should have a higher level of antibody to be continuously protected. But we know that most of these vaccines are not able to cope up with that high level of protection. And that's why when it waned after 6 months, then probably that's the reason why we need another dose. So that's the difference here compared to other viruses, wherein the threshold of protection may not be as high as compared to a COVID-19. That's why you have more sustained protection through the years with the 2-dose schedule or 3-dose schedule.
And also, Doc, is it also correct to assume that it's because there are different variants that are evolving? The disease itself or the virus itself is evolving. So there's a reason why it has to be done. It has to be done like a flu vaccine every year.
Yes, that's also one of the reason, because like for example, if you have the Delta variant that reduces a bit higher reduction of the antibody, what if you have another variant next year, and then that will be another problem to address and formulate a vaccine that will be active against that variant.
Okay. Next question. There are studies that greater immunity is better achieved from those who have actual COVID and have recovered versus those that just got the vaccine. What are your thoughts on this, Doc?
Yes, that's correct, no? Because there are data to tell us that if you have recovered, you already have this antibody, and if you are given the vaccine, 1 dose, your protection is even higher compared to an individual that doesn't have any COVID, but given the 2-dose schedule of the vaccine.
Okay. What's the difference in the reaction between the vaccine with the weakened version of the virus introduced to the body and the one that got attacked by the real virus?
You have more comprehensive, extensive immune response when you have an actual infection getting into your system, because your immune system is been stimulated, compared to a weakened virus wherein only a portion of your immune response, not only a portion, but only a particular level will be stimulated, because that's already a weakened virus, but can still be protected. But compared to a wild type virus and infecting you, that's why you have a higher response to that.
Okay. If and when boosters will be made available, are there any precautions that need to be taken before or after the third or fourth dose?
I think it's just that you'll be getting a 3rd dose. Like for example, if you are fully vaccinated with Sinovac and you'll be getting a Pfizer vaccine, no, as 3rd dose. So you need to be monitored for the adverse event of Pfizer, like myocarditis, okay, something like that. No, if you are getting the AstraZeneca, then you also have to watch out for blood clots. If you're getting the 3rd dose, because you are also at risk because of that. No? But although the risk here is really very low compared to the benefit of getting the 3rd dose, okay. If you are also getting the Janssen, diba? Janssen, as there are data on Guillain-Barré, syndrome. So those are some of the adverse events that you have to monitor also.
Doc, have we already identified the correct or the more how do we term it? What I can take as a booster shot if, for example, I took Sinovac for my first 2 doses, or I took AstraZeneca. Have we already identified the right booster shot?
Okay, if I'm going to give you my thoughts on that, like fully vaccinated Sinovac, the data is very good with Pfizer and Moderna as a 3rd dose, and even with Astra as a 3rd dose compared to a 3rd dose of Sinovac. If you have Astra, a 3rd dose of Astra is also good. If you have received Pfizer, a 3rd dose of the Pfizer vaccine is also good. So I think it's only the Sinovac that getting a 3rd dose with an mRNA vaccine, you have a higher immunogenicity compared to getting a 3rd dose of your Sinovac.
Got it. Okay. I got Sinovac as my first course of COVID vaccine. Can I take an mRNA vaccine as a booster shot once I become qualified? So I guess the answer is here is
Yeah,
yes,
yes,
Doc.
yes. Mm.
Okay. Are there any studies on effects of booster shots administered within a shorter time period after the second dose?
Yeah, I think the one that was presented coming from the Sinovac, no, when they were given less than 6 months, like 3 months, 3 months after the primary series, the immunogenicity was really low compared to those who received it 6 months after.
Okay, Doc. Next question is it true that coronavirus will eventually stop mutating? If so, when will that be? Do we have this data, Doc?
The 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 perspective here is that it will only stop mutating once there is transmission is also stopped, because the virus cannot mutate once it will not enter into our body. So remember, the body is the incubator of this virus, and the ability to mutate actively is also inside our body. So if our body cannot cope up, cannot produce an immune defense against the COVID-19 virus, then it will be a risk for the mutation. And that's why where the 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 priority for giving booster is the immunocompromised, because based on history, the first mutations were seen among those with cancer patients, because cancer patients doesn't have much of their ability to protect them, no? So that's an opportunity of the virus to mutate and change its structure so that they can maintain their presence in that body in a cancer patient. So with vaccine, they will be given protection, and it will stop the mutation, it will stop the transmission. That's the time we can say that there will be it can stop also the mutation.
Okay. I think that will be our last question. No more questions from Slido. I think the other questions are redundant already. And I think that's it for our session. Doc Jean, thank you so much for spending time with us. Do you have any message or any last words for our audience?
Yeah, so I think my message here is that for those who have not yet been vaccinated, no, hopefully you have to get your vaccines. Okay, why vaccine is very important? You know very well how important is vaccine, not only protecting us from getting hospitalized, but also from transmitting the infection to your families, no? And especially now, most of the transmission is in the household. You will also be protecting your elderly mothers, your elderly grandfathers, which is the most important part why you have to be vaccinated.
Okay. Thank you so much, Doc Jean. Thank you for your insights and sharing this morning. And also to our group HR and corporate external relations team for helping us connect with you for this info session. Again, everybody, the FAQs from this session and link to the video can be replayed, will be shared via Agora and be posted in AEV's hashtag Protected Together microsite in Ask HR. Thank you once again, everybody, for tuning in. Have a great Tuesday, everybody. Have a great week. See you next time. Stay informed, stay safe, and stay sane, everybody. Have a great day.